Welcome back to Real-ationship Goals, a podcast all about exploring the realities and complexities of healthy relationships. Real-ationship Goals is a project of the Prevention and Education team at the Advocacy Center for Crime Victims and Children in Waco, Texas. If you or someone you know has experienced sexual violence or harassment and is seeking support services or needs more information, links to resources and our hotline number can be found in the description. The views expressed in this podcast are those of the hosts and guests and do not necessarily reflect those of their organizations or affiliates. Hey guys, welcome back to another episode of Real-ationship Goals. My name's Kyla and I use she, her pronouns.
My name's Elsie and I use she, her pronouns.
My name's Natalie and I also use she, her pronouns.
Awesome. So today we are joined by another wonderful community partner that we wanted to take time visiting with and highlighting their work within our community. So Natalie has agreed to join with us today to talk about her passions in the community and some of the work that she's been doing, some of the work that she's looking forward to doing. Underscoring kind of a lot of our conversation today is going to be mentions of mental health because May is Mental Health Awareness Month. So of course, if you ever feel like you're needing help processing something or you just need to connect with other folks, of course, we always want to normalize that and support that. So never feel like you can't reach out. We all deserve help and none of us should feel like we have to carry the burdens of life on our own. And that brings us full circle back to community. So Natalie, please share with us just some of your passions surrounding the community. What does community mean to you? What does it look like to you? Yeah, there we go. Great. We'll start there.
Love it. A little context, I'm a community social worker in the Waco area, about to transition to a fun new role. So I'll be beginning as a school counselor. So I just think that's kind of cool to add to this question because the way I define community, I think we all think of community usually as a physical space that we live in, the way that we're connected by proximity. So yes, I believe that's community, but also it's like where we find, where we thrive, our relationships and the support that we find. And so I think community is always growing and a place that we feel united either in values or passions. And so along that, I get passionate about community social work in general, of just being able to walk alongside community members and programs and even just local agencies and government and seeing how we can all advocate together.
That was cool. I've never heard anyone utilize resources in community before. It's always been like, here's your community, here's the resources that are available to you, not like, here's your community.
Yeah.
So,
and that is community social work.
Yeah. I guess what are some of the things that you have been doing in your work? What are some spaces and places and focuses, I guess, that you found yourself in?
Yeah, so Waco's cool that I've been able to wear many hats in the area. So I've found myself in health equity spaces. That's where I'm currently at and about to transition out of. But I think we'll talk more about health equity later. There's a lot that could talk about that. But even just, I think one way to sum up every role I've had or every hat I've worn in Waco is finding equitable ways to give people in the community access to resources. And so I worked for another nonprofit that was emergency assistance with rent and utilities, mainly that we were known for, but we also offered case management services, group support meetings, and so parenting support. I got to lead that. It's really fun, facilitation of groups. And then I worked at another nonprofit where I was working with volunteers and educating the broader community about the clients that we serve in that nonprofit. So I think there's a whole range that you can do in the hats that you wear. And so I think, connecting everybody together in all various levels of practice.
What drew you to community social work? What about that excites you?
Oh gosh, such a hard question. All of it. No, kidding. I think so. My journey in figuring out just what social work is in general, I never really knew what it was to be a social worker, and so I went on this journey in undergrad that I knew I wanted to help people and serve people in some way, and I think we all kind of have similar stories where we're trying to figure out what our passion goes to. And my original story that people told me was, oh, then you should go in the medical field. And so tried to be pre-med in undergrad and
Retweet.
hated that
Retweet.
immediately because that's just the track people tell you. Also, fun fact, most people don't know, I was also in ROTC at the time. So I thought serving people was, my family served the country. And so I was like, oh, that's the way that I can connect and help others. And so through that journey in college, I realized, oh, I don't think this is what's meant for me and where my skills are. I also got to take some really awesome classes and read some books that just made me very angry and put me on fire about just why are these injustices in the world. And I think that's when I really landed on that I am an advocate. I think at heart and through the center of who I am, I think that's where my skills lie. I get on fire about things and I want to do things. I can't sit in the injustice. I want to move to action. I love talking about it, but I hate if we're only talking about it. And so I think through all of that journey, one of the books recommended, okay, so you've learned about these things, now what? And one of the things was pursuing a degree in social work. And that made me kind of dive into that. And then I learned in social work, you could choose clinical or community. And I think that bridging clinical and community is the truest form and the purest form of social work.
Yeah.
I think that we should I love the smiles there because I feel very passionate about it. I don't think it should be either or. I think that you need to have a mental health component and competency and understanding mental health diagnosis and behavioral health, especially when working in communities. But I think really community social workers, I can do the shout, is that you build that trust and rapport in the community that then allows to maybe go further into those clinical interventions and for them to access and be productive in an actual way. Like you need that trust and rapport in the populations that I think we all serve. Because if you've been in a system that's been constantly broken and marginalized you over and over again, it's really hard to trust someone who's saying, take this medication and come talk to me, instead of recognizing like, hey, I know you've been struggling with housing. Let's do housing first. And while we're doing that, we can talk about mental health and behavioral health. And so that was a long answer.
Oh, but wonderful.
Yeah.
Excited. I said, yes, I would follow you into social work battlefield.
Yay.
Those two
Would love
things.
that.
I would say I definitely, yes, also feel very strongly about how there already are connections between the two, but I feel like especially in like the academic realm, which we won't dive too deep into today. Come find Natalie and I on our own podcast.
Yes, we would love to.
But I feel like, yeah, there's so many different ways where they are reliant on each other or they already do exist, like where people, in order to truly serve people and communities holistically, like you have to be engaging in both. Like you can't truly tackle any problem separately with them.
No.
But
well, I actually, sorry,
no, go ahead.
I was gonna say I actually had a question going based off of that, but like you said that you have worn many hats before, but like how you interact with the populations, how is that different or similar, assuming that everybody comes to you for a different thing in each of the hats that you've worn? So I know that was a really roundabout question because I think
if I understand what you're asking, so go ahead and feel free to cut me off and be like, Natalie, that's not what I'm talking about. I think my personality, I don't know that I change in how I interact with people. I think it's always seeing the person across from me as somebody who has dignity and worth and like as a human and not a symptom to put a band-aid on is I think something that is easy. And I don't want to throw shame on relief efforts at all because that's very much needed. But I think sometimes it's very easy for us to go, oh, here's this diagnostic problem. And I know this solution because of the research. Yeah. And let's do that really quick and keep going. And I think there are times when that's needed in emergencies. For me, I don't live in those spaces well because I think it goes to, in systemic brokenness, systemic racism, systemic homophobia, all of that. We have prejudices everywhere. And so I think that relief button doesn't also hit with my passion for advocacy and fixing the injustice. And so to get back to your original question, how I engage with people, I think it really is from a stance of affirming their lived experience, and in social work, we talk a lot about moving to a strengths-based mindset. I think our society teaches us to always live in a deficit mindset. We're always looking for where are the gaps? Where did someone go wrong, quote unquote, you know? And I just find myself, one, wanting to sit in that space with that person who's trusting me to receive whatever service in whatever hat I'm wearing at the time. And just let them have a space to, one, feel their feelings, because I don't know that even when you're reaching out for help, we don't do well sitting with the feelings, I would just collectively say, for our society. So feel their feelings, know that there's no shame in feeling that and what they're experiencing, and validating like all the strength and resiliency it took to even just be in the seat that you're sitting in for whatever reason. And then looking at it as a collaborative effort, like they're the expert of their lived experience. I'm just here to help, maybe be a sounding board or to help connect and broker relationships. I think that's my posture I take. Thanks. Obviously, you can tell I talk with my hands. I hope it's not distracting.
You're welcome here. Also, that was also just leading me to think, especially with the strengths-based mindset and things like that. So I guess tying off of that, what are some strengths that you see within the Waco community itself, kind of on the topic of like health equity? Like, what are some things that Waco has in its toolbox that it's doing, or that it's doing really well in this area? And then we'll talk on the areas of potential growth. I was if you want to answer them one in the same ways that like strengths that Waco has around this area of health equity, and then some areas of potential growth. So ways we can get stronger.
No, I think that's great. Waco is so unique and just compared to any city I've lived in, and I think it is really cool how it we have so many organizations and nonprofits here, literally hundreds if you're not familiar with Waco. And so that can be a super strength and also an area for growth is, you know, looking at, are we recreating the wheel? Are we not collaborating? But I do really think I've been here for over 10 years now, which is wild to me. I think when you look at the history of Waco and where we are now, we've made huge strides in, there's this movement in Waco right now to work together, and for organizations to come together and provide services. So I think one, I work at Waco Family Medicine currently. I'm about to transition out of this role. But one thing with health equity is at their new clinic, they have a physical hub. So that's what I do is I get to coordinate a physical hub of community partner offices where it is literally in the clinic where you're coming for medical resources. You can also be referred down for social drivers of health. So there's a term in the medical space called, it's normally social determinants of health. They call it social drivers because we don't think determinant is very empowering. And so it includes legal access, it includes housing resources, maternal health resources, Highview Insurance, which offers free insurance advice and registering for healthcare.gov insurance plans. They also help people apply for Medicare. And so they are helping individuals who are 150% below the poverty line access $0 or $15 insurance a month. And so health, when I think of health equity first in America, we need to talk about health access and insurance. Insurance is a huge one when we're privately insured dominated culture. And so I love that there are resources here specifically in Waco to help get you coverage so that you can get access to all and choices. I think choice is a big thing in health equity. A lot of times when you're limited to a certain resource, you don't get to choose. You're just like, oh, this is the only psychiatrist in Waco that accepts Medicaid or no insurance, you know, or this is the only PCP that accepts XYZ, right? And so,
and then what if you have a bad experience with that partner? And then you're just like, okay, well, I guess I just
won't get that service.
I guess I'll just suffer and waste away. Awesome.
Yes.
Thank you.
We don't love that. So there's that first, that physical hub of just holistic wraparound services, seeing health. Sorry, I did trail off. So social drivers of health is what research shows us that 80% of our health is impacted by things that happen outside of the exam room. So Waco, I think, is really advocating for understanding that, like your physical health, your mental health, your behavioral health is impacted by things that happen outside of a medical diagnosis, right? It's where you live, it's where you work, it's where you eat, it's what you eat. It's how you socialize. And so that all is going to impact what health diagnosis you're going through or just preventative care. And so I think we're really in an innovative space compared to even just in Texas in general. The other thing is I think we're seeing a lot of momentum and movement again with that collaboration. So we have Behavioral Health Network here, who I already know like has a very direct relationship with our police department and our sheriff's office. And I think that already is a testament to naming that behavioral health and mental health experiences and disorders that somebody is experiencing is something that is health equity and understanding that. And unfortunately, in Texas, the primary response team for someone going through that who does not have the socioeconomic status is going to be a police officer being called. And so making sure they're trained and then also have the accurate resources to get that person connected. Yes. Areas of growth. I think I kind of mentioned it. I think that although we are moving in the right direction, we do have some people and some organizations that are doing the same things. So duplication of services. And so if we can get connected, I think communicating. We have a lot of coalitions in Waco. We have a lot of groups in Waco that are all talking about the same thing. And if we could just get them all together, I think is a really great opportunity for growth. We could see a lot more of that happening.
Also, sometimes I feel like, and this is something that we struggle with and are still trying to figure out navigating the best way to do, is it's a lot of times attempts at change is coming directly from organizations rather than individuals.
Yes.
And it's organizations working to change the community rather than working within and alongside the community. So that's something that like we've been trying to figure out, like how do we connect with not just other organizations, which I feel like we're in a wonderful spot with that right now. I'm very proud of a lot of that work that we've done. Now, how do we transform that into individual connections? Like how do we find the people that I know for a fact exist because Waco was too big for them not to exist, but individuals that feel strongly about like engaging in health, like creating health equity in our community. Because that's a new area of focus for like our team, and it's creating health equity, creating safe and accessible like social and physical environments is another bigger focus for us in the future. And then of course, like how do we find individuals that have a passion for ending like sexual violence as well. That can be hard because that is also like we're asking people to take time that they probably already don't have. So it's but that was something, all getting carried away with China back, that's something that I feel like is definitely an area of growth for them. Speaking from like an organization perspective, like that's something that we're working on, and that I think a lot of other organizations should probably also dedicate a little bit of time to as well.
Even to further that, not only seeking those who have a passion for creating these systems, but something I think the Advocacy Center already does well, but highlighting individuals in the community who have the lived experience of it, and like having them, again, going back to the experts of their own lived experience, having them inform the best way instead of let's all organizationally or top level, let's say macroly, come together and make this plan and then try to implement a program starting from the grassroots, right? And from the community and saying what programs or what interventions do you think would be helpful instead of us coming in with that plan already established. Which again, I want to highlight, I think the Advocacy
Right. That was also something that was spoken about in every single one of my classes.
Yeah.
Is like you're not going to get anything done if the stakeholders or there was another name for them. Constituents started with a G. But anyways, without those very important people in the community, if you don't have them on board, then you're not going to have the community on board, which means that as much work as you put into that program, it's not really going to do anything. But I think that just going to pull a plug here for Falls County Community Connections. I think that they do a great job, especially the mayor of Galinda. She was there last time, and they were talking about like all of their individual programs that they do and wanting to bring in other community resources to make it more accessible for the seniors that they have in Galinda. She was doing a really great job, and Cheryl knows everybody, so Cheryl can connect you to anybody that you would like to know. Love it. Just wanted to put that plug in there for you.
Love it. So being mindful of your time and our listeners' time, of course. Be mindful of your time, viewers at home. I guess before we kind of step into our relationship goal and anything, what are any particular like favorites of yours or recommendations you would have for folks getting connected in the Waco community? Like, what are some maybe of your favorite areas? I find joy with this group or with this organization, things like that.
I want to highlight a coalition and work group that Kyla and I are both on. So the Healthy Women and Children's Coalition has a Healthy Women's Work Group, and we are doing Bloom and Grow events monthly. Our last one was a Galentine's Day at Waco Family Medicine, which was really fun. This month we're joining the yoga that's already happening at the farmers market. So I think that is March 29th, I think. We'll confirm it.
Yeah. Keep an eye out on social media.
On social media. It is the end of March, and it's going out on through July, I think.
Yeah.
And so
events.
I've just loved that. The heart of those groups have been, again, health equity, right? Pairing well-being and wellness with the social need of getting just individuals together who want to spend time together and get to know. And so we've got to meet a lot of new people. Anybody is welcome. It's a free event every month. And so check that out. It's always going to be on the Public Health District's social media. It's called the Bloom and Grow event. So that's one definitely. I think also just supporting local businesses. So just you'll be surprised who you meet at locally owned coffee shops. And I'm going to have to highlight Thirst Coffee Shop is awesome. Andreas is the owner. Just go and chat with him and ask him about his coffee shop and meet those who are around. And so, yeah.
Good recommendation. I feel like that transitions us really well into our relationship goal. So our relationship goal for you this week is, because May is Mental Health Awareness Month, dedicating some intentional time this week to checking in with yourself. There are several free self-assessments that you can do online, also checking in for burnout, secondary or vicarious trauma. If you do a lot of work with people experiencing trauma, you can sometimes start to develop those symptoms, but just taking time, even just sitting down with yourself and saying, okay, physically, how am I feeling? What parts of my body are hurting or sore or tired? Am I just tired? What about emotionally? What am I experiencing? And just kind of taking the time to check in with yourself to see what you need to be your best and healthiest self. And then Elsie has our recommendation.
Yes. So, as Natalie mentioned, she's going to be a school counselor. Yeah. So for those of you that are in school, go hang out with your counselors, see what they're like. For those of you not in school, familiarize yourself with your mental health resources that you have in your community, just so that you can further along Kyla's check in on yourself.
Get those resources. That's all from us for this week. Thank you so much for tuning in. We'll be back again next week with another fun media analysis. But in the meantime, if you want more prevention content, you can find us on Instagram at ACCVC_prevention. Or if you want to keep up with what the Advocacy Center is doing in general, you can find us on Instagram and Facebook at Advocacy Waco. But in the meantime, we'll see you next week. Bye.
Thanks so much for tuning in to Real-ationship Goals. This episode was produced by the Prevention and Education Department of the Advocacy Center for Crime Victims and Children in Waco, Texas. Interested in more content from PNE or the Advocacy Center? You can follow us on Instagram at ACCVC_prevention or on Instagram and Facebook at Advocacy Waco. Be sure to like this episode and follow us wherever you get your podcasts. See you next time. Bye.